Welcome, Doc Slaton Live, the brain's body, the ultimate experience. That's you. And we're talking about is mental health in child development through levels of self-awareness. But it begins with the conversation we were having in the last episode. So I'm talking about human system science. And I had several students contact me by email after reviewing last week's clip and say, well, what is human system science? I mean, that's what I'm being asked. And after they couldn't explain it, they wanted to hear it from me communicating it out loud. Because human system science is not neuroscience. I've been working with children and families in crises. And the last thing a parent wants to hear is that you're talking about neural activity and they're just trying to figure out what's going on and what happened to their child, or the child's trying to figure out, how do I get through this? And it's easier to tell them socially that their physics is involved in developing negative energy because of the way each other feel to the other. And now I talk about sense path and receive path. And when I talk about the sense path, it's easier for them to understand the physics of self and relate that to interaction. And the interaction is what's invisible. That's the neural system. What we're talking about, brain, body, and sense systems. We're talking about physics, neurophysics, and neurophysiological sensory systems. And so it's easier when you talk about human system science because you're grounding them in understanding we're developing your human technology, brain, body, sense, awareness, in relation to how you sense and receive contact, because we're trying to move out of crises. And to do that, we have to make sense of the contact. So when we're talking to you, we're talking about contact, and the brain exercise is practice making contact in the home. So you make contact in the home with a person who's supposed to care or be interested in you. So when you feel the contact, step back and observe what it looks like. That's social, physical, neurological activity. That's visible. That's human system science. Because what do you want to do? You want to improve sense and receive path performance. So if you have damaged sense path, you want to improve the way a person experiences something else and develop a sense of feel, even if it's not there, through acting. So modeling has a lot to do with it, but we're not talking about training, we're talking about processing. And it's easier for a child to process the act to interact. Once they understand, because that's what you try to teach them, how to process the experience of energy, action, and feelings. This is human system science I'm talking about. And so that's how it was developed. On the front lines, working with children and parents in crises, going into home, school, neighborhood, and workplace networks, parents' workplaces, and helping them make sense of how to communicate brain, body, sense systems, because the human system is about advancing your capacity to become aware of what your brain, body, and senses are messaging as a whole. When you're disorganized, you can't sense. Why? Because something's blocking the flow. And if it's something blocking the flow, remember the body is the body. It's the physics. It has to be neurologic. It has to be in the transfer of energy, action, and feelings to the brain. And when you're teaching a parent human system science, you're teaching them about the brain. And it's easier for them now to understand what you mean by mental or emotion, because mental and emotion are developmental processes. And when you talk about a state of mind, it's easier now for a parent to understand when you say you're in a negative state of mind. Why? Because they understand the brain produces mental states. So the mind is a product of environmental influences, and teaching the parent how to respond teaches them how to review their interaction with their child to understand how their behavior influences negative energy, negative feelings that then allow the child to become frustrated with the parent's contact. And that's just teaching them how to move through contact, energy, understand their technology, to interact, processing information, forward and backward. That's human system science. That's what we're talking about today. So today's session is to give you a deeper understanding of Dr. Slaton Live and human system science and brain talk books. Now stay tuned and enjoy this session.
The role of the human systems scientist. A human systems scientist, such as Dr. Slaton, brings specialized knowledge in the study of brain, body, and sense events that influence the functioning of sense and receive pathways. This expertise allows for a deeper understanding of how children establish contact and interact within various environments. By examining the factors that impact these pathways, the human systems scientist contributes valuable insights into improving the way people connect and engage, which classifies how well they interact to communicate. For example, how sense and receive pathways refer to physical and neural systems that allow children to perceive and respond to their environment. How a child and parent make contact as a sense event and interact as a neural system. How a child recognizes the role of a teacher and receives instructions as signs of social and academic awareness. How a child shows signs of care and acts to play that reveals their social and academic awareness. How a child responds to the concept or work and participates in the performance of specific tasks. Human systems science addresses sense and receive path damage through customized learning plans. Improve contact in the home. Improve interaction in the school. Improve cooperation in the neighborhood. Improve participation in the workplace. Customize learning plans for addressing sense and receive path damage. Human systems science focuses on creating targeted strategies to repair and enhance sense and receive pathways through individualized learning plans. These plans are tailored to the unique needs and environments of each person and aim to strengthen connections and interactions in key areas. Areas for improvement. Improve contact in the home. Improve interaction in the school. Improve cooperation in the neighborhood. Improve participation in the workplace. Brain Talk Books. Brain Talk Books presents a curated collection that explores the intricacies of the social and cognitive brain through well-crafted narratives focusing on brain, body, and sensory events. Each volume is dedicated to a thorough examination of conceptual topics, mental health considerations, and self-awareness. Key themes. Comprehensive discussions regarding brain function and human systems science. Clear and accessible perspectives on mental and emotional development. Narratives and viewpoints that integrate scientific understanding with everyday life experiences. Human systems science meeting discussing mental health and self-awareness. Human systems science toolkit. Dr. Slaton's Brain Talk Books. Exploring how the brain's body functions to sustain mental health and self-awareness. Examining the processes by which the neurophysiological networks of the senses organize brain and body connections. Understanding the ways brain learning influences self-learning. Investigating how special words impact neural responses. Considering motivation from a progressive investing study of self-research, self-discovery, and self-help social and academic perspectives. Why Dr. Slaton Live is the feature. This section explores the significance of Dr. Slaton Live as a central element in advancing approaches to children's mental health and self-awareness. The program acts as a featured platform that brings to the forefront innovative practices in engaging with the child's developing sense of feel for self and the brain. Understanding the brain talker. A brain talker is an individual or approach designed to communicate directly with the child's brain. This concept highlights the importance of tailoring language and strategies specifically for the brain, with the goal of nurturing cognitive and emotional connections. The new frontier in brain talk. Brain talk is evolving, marking a new frontier in the way we interact with and support the development of young brains. This progression is characterized by the use of intentional, brain-focused communication strategies that prioritize the unique processing abilities of children. Talking to the child's brain, not the body. To talk to a child's brain, rather than merely addressing their body, means recognizing the brain as the central organ for integrating experience, emotion, and behavior. This shift in approach allows for more meaningful engagement and lasting changes in a child's thought processes and actions. The Progressive Investing Institute of Focus Learning is the private practice of Dr. Christopher K. Slaton. Dr. Slaton is dedicated to advancing research and education in human systems science, with a focus on improving mental health outcomes for children and families. Contact Dr. Christopher K. Slaton, author of Brain Talk books. Email braintalk@drslatonlive.com. www.drslatonlive.com. Event. You're invited to RSVP for Dr. Slaton Live on September 13, 2025 at 10 a.m. This session will address Unlocking Human Systems Science, a path to improving child mental health, covering topics such as self-actualization, emotion management, brain-body connections, and neurophysiological changes. Attendees will benefit from practical strategies and real-world case studies designed to facilitate the application of human systems science principles in both daily life and professional settings. Recognition. Participants will receive a personalized notice of participation, access to downloadable resources, invitations to subsequent meetings, and membership in an expanding community dedicated to human systems science support.